Medicare Part D, Prescription Drug Plans, the Basics. Hi, this is Jim with InsuranceInfopedia.com. Today we're going to talk about Medicare Part D, prescription coverage. Because this is a fairly complicated issue, you'll probably want to check out the additional recordings in this series covering enrollment periods, penalties, special assistance, and considerations in comparing plans. This recording will just cover the basics. The U.S. government put together Part D to help Medicare enrollees pay for prescription medications. The program began in 2006. The idea was to give some help to a lot of people and a lot of help to some people, with the most help going to those whose medication costs would reach a catastrophic level. You buy the plans from private insurance companies, but the plans are required to meet or exceed in some way the basic design structure that the government put together. This structure can have up to 4 levels: an initial coverage period, a catastrophic coverage period, a gap in the middle, also known as the donut hole, and some plans will have a deductible. These periods start and end at intervals based on the cost of medication purchased. The costs are figured on a calendar year basis, so every January 1st you start at 0, and your costs accumulate over the course of the year. Of course, one person's costs will build up at a completely different rate than another person's. Now, it's important to understand that the figures being added up are not the amount you are paying, but instead are the gross amount, a combination of the amount you are paying and the amount the insurance company is paying, roughly equal to how much you would be paying if you didn't have coverage at all. Okay, let's go back to the structure and look at the numbers. These numbers will be adjusted every year, and we're going to use figures here that apply to the plans for calendar year 2010. Like other insurance, you might have a deductible, an amount that is your responsibility before the plan starts to help you with your costs. Many plans, perhaps most, won't even have a deductible, but if they do, it cannot be more than $310 for 2010. So your initial coverage period will start either on January 1st or as soon as you've met your calendar year deductible. And during this period, you are paying reduced rates for your prescriptions. A basic standard plan would have the deductible and then will have you paying 25% of the prescription costs, with the insurance company paying 75% during this initial coverage period. But most plans will reduce the deductible and have you paying a flat copay for your medications, with lower copays for generic drugs and higher copays for the preferred and non-preferred brand name drugs. You will receive these discounted rates until the total costs for your medications reaches the dollar limit that the government has set for the current year. For 2010, the figure is $2,830. At that point, you've reached the coverage gap, a period also known as the donut hole, where you no longer get the discount and you pay the full amount for your prescriptions. This coverage gap will continue until you reach the catastrophic period, where your costs would drop to about 5%, with the insurance company paying some and the government picking up the rest. In 2010, the catastrophic period starts when the cost of your prescription reaches $6,440. Or your out-of-pocket costs reach a total of $4,550, whichever comes first. And again, because all of these figures are based on a calendar year structure, when you get back to January 1st again, you start all over again at 0. Now, many people will tell you that they have a plan that doesn't have a donut hole. Most of these people are wrong. They simply didn't spend enough on medications to reach the donut hole, and on January 1st they reset at 0 like everybody else. These people are lucky. Now, there are higher cost plans out there that give you some protection on generic medications, but those medications are pretty low cost in the first place. So don't expect to find a plan that will protect you on high cost brand name medication during the donut hole until you can find an insurance company that likes to lose money. Look for other recordings in this series at InsuranceInfopedia.com. This is Jim. Thanks for listening.